Okay, today we'll discuss the lymphatic drainage of the head and neck, upper limb, and thorax. In the morning, we discuss about the general features of the lymphatic system. Now we'll go to particular structures, areas, and we'll try to understand them. As I showed before, this picture had shown that there are the palpable lymph nodes which are in the cervical region, axillary, inguinal, as well as epitrochlear, as well as the popliteal. Then there are lymph nodes which are non-palpable, like the mediastinal. Then we have the mesenteric, para and pre-aortic, all those. Okay, we'll go into details about each of them. So just once again, will revise what exactly we discuss, and then we'll go further. So as I discussed in the morning, that is the lymphatic system, the drainage system of the body. It consists of the lymphatic tissues and the lymphatic vessels. We had seen the lymphatic vessels as well as the lymphatic tissues, including the organ. The lymphatic tissues are made up of the connective tissue that contains large number of lymphocytes. Okay, as we had seen, all the lymphatic organs and lymphatic tissue have the lymphocytes, which will be added up, which increases the immunity. So the lymphatic organs included the thymus, lymph nodes, spleen, lymphatic nodules, and other things, which helps in the immunological effect against the bacteria and viruses. And then we saw the lymphatic vessels, which are thin tubes. Okay, so these lymphatic vessels are present everywhere in the body, except, so there are exceptions where they are not present in lymphatic system. One is in the central nervous system. Central nervous system, the lymphatic system is not there. The eyeballs, it is absent. In the epidermis, it is internal ear, it is absent in the cartilages and bone. Except these areas, the lymphatic system is present in all other structures of the body. Okay. Then we had seen that the lymph is a tissue fluid which will be flowing through the lymphatic vessel. It will be colorless fluid except when it is coming from the abdomen. And we had seen the lymphatic capillaries, which are very thin vessels which cannot be seen by the naked eyes except the larger one. And they are so thin that the presence of the valves within them will make it beaded in appearance. Okay, I will show you the picture later. So where we'll see it looks like a beaded appearance. Okay. Then we had seen the lymphatic vessels. The largest will be the thoracic duct, which will be draining into the junction between the left intrajugular and the left subclavian vein. Similarly, on the right side, we have a small duct called as the right lymphatic duct, which is a very short duct, which will be opening. And then we had seen the lymph nodes, which have afferent lymphatic vessels as well as the efferent. Okay. Now going to the cervical group of lymph nodes in the neck. So in the neck, so these are called as cervical, and there are different group of lymph nodes here. Okay. So if you see here, there are different groups. As I said, there will be something called as around the ear. These are called as the pre-auricle, which are in the front. Pre means in the front, pre-auricular. Then we have the post-auricular, behind, post-auricular. Then we have the occipital group of lymph nodes. We have the occiput. Then near the parotid gland, we have the parotid. Then we have the inside, we have the tonsil, and outside we have the giglo-digastric group of lymph nodes. Then we have the submandibular as well as submental lymph nodes. Okay. Then here in the neck, this part, we have the superficial and deep cervical lymph nodes. We should remember there's all these group of lymph nodes. Finally, they all drain into the deep cervical group of node. Even the cervical superficial cervical group of lymph nodes, they all finally drain into the deep cervical group of lymph nodes. So if you see the lymphatic drainage of the head and neck, even though the brain doesn't have the lymphatic system, but the head and neck has lymphatic system. Okay. So the lymphatic drainage from the anterior part of the skull. So this is the anterior part of the skull and this is the posterior part of the skull. So the anterior part of the skull, as you can see here, it is draining into the pre-auricular group of lymph nodes as well as the superficial parotid group of lymph nodes from the anterior part of the skull. So the posterior part of the skull, it will be draining into the post-auricular, mastoid, occipital group of lymph nodes. Finally, they all drain into, as I said, into the deep cervical lymph nodes. Okay. Now coming to the tonsils, we had just seen the briefly the tonsils. Now we'll go into some more details about this tonsil, which is present in, again in the head and neck, especially in the posterior part of the oral cavity. So the palatine tonsil are a masses of the lymphoid tissue located on the lateral wall of the oropharynx. So they are present on either side of the oropharynx. Okay, between the glossopharyngeal and the palatoglossal arches, palatoglossal as well as the palatopharyngeal. If you see here, this is called as the, so here in the front, if you see here, this is the palatoglossal, and behind we have the palatopharyngeal. Here, if you see, this is the palatoglossal, and behind there is the palatopharyngeal. In between, we see the tonsil. So it is covered in the front by the palatoglossal and posteriorly by the palatopharyngeal. The surface, if you see, it looks like pitted. If you see here, it is pitted. Lot of pits are there. Okay, by numerous small openings that lead to the tonsillar crypt. I had told you there are crypts within that where the food will go and get trapped inside and get sensitized. Okay. Lateral surface is covered by the fibrous capsule. This is the tonsil here. Now, if you see here, so this is the oral cavity, and here you can see tonsillar crypts, which are imagination, where the food gets trapped. And it is not covered by capsule here. As we know, all the organs, lymphatic organs are covered by the capsule except the tonsil. Tonsil, it is partly covered. Posteriorly, it is covered by capsule. Okay, but not anteriorly. So the lateral surface is covered by the fibrous capsule. This is the lateral surface covered by the fibrous capsule, but not the oral surface, because it shows the crypts and it has to be sensitive. Okay, for that. Reaches maximum size during early childhood. This tonsil plays a very important role clinically. Okay, especially in case of the childhood, it reaches the maximum size. Okay. Then the blood supply of this tonsil is by the tonsillar artery. This is the tonsillar artery supplying the blood supply. It is a branch of the facial artery, and the venous drainage will be to the external palatine or the paratonsillar vein. If you see here, this is the external palatine, or it is also called as the paratonsillar vein. Okay, which will drain into the venous blood. Okay, this is important because clinically, when we do surgery, so if you don't block this artery properly, then it can lead to severe bleeding. Okay, even though the surgery is very easy, but usually it leads to severe bleeding because of this tonsillar artery. Okay, as well as even the paratonsillar vein, sometimes it can bleed. The lymphatic drainage is to the jugulo-digastric lymph nodes, which are present in the neck, and the nerve supply is by the glossopharyngeal as well as the lesser palatine nerves. Now coming to the Waldas ring, which I was telling in the morning about the Waldas. There is a ring around, so which forms a ring around the oral cavity and the nasal cavity. Around the nasal cavity and the oral cavity. What is this Waldas ring? Waldas ring of lymphoid tissue around the oral cavity and the nasal. The nasal cavity is here and the oral cavity is here. So anything coming from outside through the nose or to the mouth has to go through this first line of defense. It is a ring formed by the group of lymphoid tissue that surround the opening of the respiratory and digestive system. So there is a ring formed which is around the respiratory as well as the digestive passage. This is the digestive passage, this is the respiratory passage. The lateral part of it is formed by the palatine tonsil on either side. If you see, this is the Waldas ring. So on either side we have the palatine tonsil, right and left palatine tonsil. Okay, in the roof we have the pharyngeal tonsil. This is the pharyngeal tonsil here in the roof of the nasal cavity. So which form the pharyngeal tonsil or the adenoids. Then in the lower part it is formed by the lingual tonsil. I said the posterior 1/3 of the tongue will be having a lot of lymphoid tissue. So this forms the lingual tonsil on the posterior 1/3 of the tongue. So here if you see in the floor, it will be called as the lingual tonsil. Okay, so the palatine tonsil on the either side, as well as there are also something called as tubal tonsil just beside the entrance of the auditory tube. There are tubal tonsils. So pharyngeal tonsil on the top in the nasal cavity, lingual tonsil in the floor of the tongue, posterior one third of tongue, and the palatine tonsil on either side, and the tubal tonsil on either side. So everything has to pass through this first line of defense. Anything from the oral cavity or the nasal cavity has to go through this first line of defense. So that's why this forms a ring called as the Walde's ring. Okay, Walde's ring. Now coming to the applied aspect, how this is clinically important. So especially the peritonsillar abscess, the tonsil, this patent tonsil, usually it gets infected in case of young, the childhood or in the adolescence. We can see this, these tonsils get infected because the immunity has not well developed. So these peritonsillar tonsils get peritonsillar abscess because of infection. There will be abscess, and this condition is called as quinsy. If they get infected, these palatine tonsils get infected, then it is called as quinsy, where there is a abscess. Similarly, in case of small children, the adenoids, these paratonsillar, the pharyngeal tonsils, get infected. Infection of the pharyngeal tonsils. This condition is called as adenoid, especially in case of small children, the breastfeeding children. So in those children, if this pharyngeal tonsil become enlarged because of the infection, it closes the nasal cavity. The child cannot respire, and whenever it tries to breastfeed at that time, because it cannot respire at the same time, he doesn't drink milk. Okay, this is especially complicated in case of the children. So whenever it is infected, these pharyngeal tonsils, these are called as adenoids, in case of, especially in case of small children. Okay, so this is about the cervical lymphatic system. Now we'll go to the axillary part. Axilla, as you know, it is between the thoracic region and the upper limb. The space here, this is called as the axilla, and there are axillary group of lymph nodes. So there are 5 groups of lymph nodes, that is the anterior, then we have the posterior, lateral, and central and apical. If you go deep inside the axilla, then there will be apical. Central will be in the floor, anterior near this muscle called as the pectoralis major, behind will be having the posterior, lateral will be on this bone, that is the humerus, and medial will be toward the chest wall, central will be near the floor of this axilla, and deep inside, if you palpate, that will be the apical. So these are the 5 group of lymph nodes. If you see here, again this picture is showing there is a lateral, and this is the posterior, this is the medial, anterior, apical will be under deep inside. If you go deep inside, then there will be apical group of lymph nodes, and here are the central group. So that is about the axillary group of lymph nodes. Axillary group of lymph nodes is very important, especially in the examination. All group of lymph nodes, especially those group of lymph nodes which can be palpable, like the cervical, axillary, and inguinal, it is a must to examine these lymph nodes, feel these lymph nodes whenever there is clinical examination. No examination is complete unless you examine these lymph nodes. Okay, because these lymph nodes indicate a lot of things. Okay, normally the lymph nodes cannot be felt. Okay, so when it is felt, then it means they are enlarged due to some infection or something else. Okay. Now coming to back to the thymus, the third structure. So as we have already studied some features, we'll go some more into details about this thymus. One of the important lymphoid organs situated in the anterior superior mediastinum, as we see that it is just behind the sternum, well developed at birth up to the puberty, and it is bilobed, two pyramidal lobes on either side, just like that of the thyroid gland, connected by the 2 lobes are connected by the areolar tissue. Developed from the endoderm of the third pharyngeal pouch. So it is developed from the third pharyngeal pouch. As we have seen already, the weight at birth will be 10 to 15 grams, reaches the maximum size at puberty to 30 to 40 grams, and by the mid-adult age group, it goes back to the size of that of the at birth, that is 10 grams. Okay. So this is the thymus developing from the third pharyngeal pouch. Third pharyngeal pouch. These are the pharyngeal pouches. So this is developing from the third pharyngeal pouch. Coming to the blood supply, it is supplied by the internal thoracic artery as well as the the inferior thyroid artery. Two arteries will be supplying this thymus. This is the thymus, this is the thyroid gland. This is the thyroid gland, this is the thymus. Okay. Venous drainage is by three veins: left brachiocephalic vein, internal thoracic vein, as well as the inferior thyroid vein. So these two structures are similar to this one. Okay, these are the arteries and these are veins. Apart from that, the left brachiocephalic vein also drains. Coming to the nerve supply, it is the vasomotor, it is by the stellate ganglion, and the capsule is supplied by the phrenic nerve as well as the descending cervicalis. Now coming to the thoracic duct, this also we have briefly discussed. Again, some more features here. As I said, this is the largest lymphatic vessel of the body as well as the principal lymphatic channel, because as we saw, almost most of the parts of the body will be drained by this lymphatic channel. This is the thoracic duct. So that's why it becomes the principal lymphatic channel and the largest lymphatic vessel, which conveys chyle and most of the lymph of the body into the bloodstream. Okay, so it will convey back the all of chyle from the abdomen. Chyle, you know what is chyle? It is the absorbed nutrition fats within which is in the lymphatic, which make it milky. Okay, in other parts the lymph will be clear colorless fluid. Okay, so this will be drained back into the venous system. So it will bring back into the bloodstream. Extend from the second lumbar vertebra to the base of the neck. As we saw, it begins from the cisterna chyli. From the saccular dilatation called as the cisterna chyli, extends all the way through the thorax in the posterior thoracic wall. Initially it will be on the right side, then goes toward the left side, and then opens at the junction between the internal jugular as well as the left subclavian vein. Okay. Drainage drain the whole body except the right side of the head and neck, right upper limb as well as the right thoracic region. Okay, so it will be, this is the same cisterna chyli here, and this is the thoracic duct going extending beyond the posterior thoracic wall on the vertebrae, going initially out to the right side, then it goes toward the left side, and finally drains here. Okay, coming to the some of the characteristic features, it is flexuous as well as beaded. If you see here, it looks like beaded because of the presence of valve provided by the numerous valve. It is so thin that even the presence of valve make it beaded in appearance. That's why this lymphatic channel looks beaded, so that we can easily identify this, differentiate from other veins and other structures. Okay. Measurement, it is almost 40 to 45 centimeters in length, width is almost 0.5 centimeters, and slightly sinus, constricted at intervals and appear very coarse. Okay. The termination will be at the junction of the left subclavian, as we have seen, left subclavian as well as the left internal jugular. This is the left interjugular, this is the left subclavian vein. At the junction, it will drain back and drain all the tissue fluid back into the circulation, so that there is no decrease in the volume of the blood. Now coming to the new thing, now what are the tributaries which are draining into this thoracic duct? Till here we had studied the thoracic duct, but we did not study about the tributaries. Now we'll see what are the tributaries which are passing through this thoracic. This is the thoracic duct. So what are the tributaries? A pair of descending limb trunks. If you see here on the top, there will be a pair of descending thoracic lymph trunks on either side coming here. Okay, a pair of descending lymphatic trunks, each drain the posterior intercostal lymph nodes of the lower six thoracic. Lower six thoracic spaces will be drained by this descending lymph trunks. Then a pair of ascending lymph trunk, each drain upper lumbar lymph nodes. If you see here, these are the ascending lymph trunks which will be coming from the above, from below upwards, which will be draining the lumbar region, okay, especially the lumbar region. Then we have the vessels which drain the posterior mediastinal lymph nodes and the posterior intercostal lymph nodes of the upper six spaces. Lower six spaces, intercostal spaces, descend drained by the descending thoracic, but the upper six will be draining directly. If you see here, these are the vessels which are nothing but the posterior mediastinal lymph vessels which are directly draining into the thoracic duct. So the upper six, lower six by the descending thoracic lymph. Then the left jugular limb. Left jugular limb, if you see here, this is the left jugular limb draining the left half of the head and neck. So this left jugular lymph trunk will be draining the left half side of the head and neck part. Okay, the right will be draining into the right lymphatic. So only the left half of the head and neck and face will be drained by the left internal jugular, as well as the left subclavian. If you see here, this is the left subclavian, which will be draining the left upper limb. The whole of the left upper limb will be drained by this. Okay, both open at the termination of the thoracic duct. So before the termination of the thoracic duct, both the left internal jugular as well as the left subclavian vein will lymph trunk will drain into the thoracic duct, and finally the thoracic duct will drain into the junction between these two vessels. Occasionally, left bronchomediastinal lymph trunk, which drains to the left lung and left side of the heart, can also drain. Sometimes the left brachiomediastinal lymph trunk also drains into the thoracic duct. So all these are the tributaries. These are the 5 tributaries which are draining into the thoracic duct. These are called as tributaries, just like in case of vein. Veins also drain, so they are called as tributaries. Here also, all these lymphatic vessels are draining into the thoracic duct. That's why these are called as tributaries, not branches. In case of arteries, it will be branches because they will be dividing. Okay. Now coming to the right lymphatic duct, we had seen the right lymphatic duct is a very short duct, almost 1 centimeter long, and it will be the right side of it will be draining the right side of the head and neck, right upper limb, as well as the right thoracic region. Only the right side of the head and neck, the right thoracic region, as well as the right upper limb. Okay, that's all. So this is a short duct, terminates at the junction of the right subclavian and the right internal jugular. Just like here, it drains into the junction between the left subclavian and the left internal jugular. Similarly, the thoracic duct will drain into the right junction between the right internal jugular as well as the subclavian vein. That's the right subclavian vein. Okay, so same junction, same points. Okay. Now finally, coming to the development of this thoracic duct. The thoracic duct, I said it will be initially on the right side, then it moves toward the left. If you see here, it is moving toward the left side and draining into that. So initially, it will be not like that. Initially, during development, it will be 2 ducts actually. So there will be 2 ducts like here, as we have seen. So the thoracic duct will be bilateral in development, and it is developed from 3 sources. 3 sources. Okay. So the lower vertical part will be developed from the lower part of the primitive right duct. So this part will be developing from there are 2 ducts, right and left primitive duct. So the lower part will be developing from the right primitive lymphatic duct from here. Then the intermediate oblique part is derived from the cross connection between the right and left lymphatic duct. So there is a cross connection between the right and left lymphatic duct. So this is developing this part, especially this part of the thoracic duct. Then the upper part, the upper part is developed from the persistent cephalic part of the left lymphatic duct, left primitive duct. So the cephalic part, this will develop into the remaining part of the thoracic duct. So the lower part develops from the right, then the upper part develops from the left primitive ducts. So the remaining parts of these ducts will disappear. This will disappear, and this will disappear. So only there will be lower part of the right and the upper part of the duct and the connection between these two. So this will develop into this thoracic duct. So that's why it looks initially on the right side, then crisscrossing, then going toward the left side. Okay, so this is how it looks like. But developmentally, there are actually 2 ducts, which will later form a single duct with the disappearance of the remaining part of the duct. Okay, so this is all about this lecture, which is related to the lymphatic ducts of the lymphatic system of the head and neck thoracic region. Okay, so most of the things we have already covered in the general lymphatic system. So here it was just brief extra additional information which I added here. So if you have any doubts regarding this, you can ask me now.
Okay, doctor. Is all lymphs drain into the thoracic duct?
All finally drain except the right side of the head and neck and upper limb. right upper limb as well as the right side of the thorax, except that all other lymphatic system finally drains into the thoracic duct.
Okay.
Anything else?
Thank you,
Okay.
doctor.
Okay. Thank you. Thank you very much.